Hello, it's Dr. Leo Kormanik with Running Rehab. These set of exercises I'll show you here, this simple little series, is very near and dear to my heart. So my first major injury that I had was Achilles tendonitis. To this day, in all my marathons and all my running I've done, my major injury is my Achilles. It's something I consistently have to deal with. I just have wrecked them with all the years of running and poor management of my Achilles. So this is something that I do on a daily basis to get my Achilles to repair. Now, this is critical that we go through a little bit of definitions. I'm not talking, these exercises are not for acute Achilles tendonitis. They're not for if you have an Achilles tear. They're not for if you strained your Achilles really bad on a long run and it's like really inflamed and just clearly swollen. This is not your set of exercises. This is if you have chronic Achilles tightness and chronic low-grade Achilles pain. That is not acute, meaning it didn't just happen, it's just always sore. Like my Achilles is just always sore. I literally start every run and my Achilles are sore unless I do these exercises, okay? So basically, we're dealing with Achilles tendinopathy or Achilles tendinosis, which are just fancy terms that basically just describe that the Achilles is old and it's dehydrated and it's breaking down. That's just it. So there's just fancy terms that are just describing that. So, but you can still run with it. And here's how you can do it. First of all, do not stretch these guys. And if you do really feel like you have to stretch it, like if your PT or chiro or doctor is telling you to stretch it, be very cautious and don't crank on it. Like don't go and just really wrench on it. That's a terrible idea. And the concept is not hard to understand. If I have a dehydrated, frail rubber band that appears it's going to snap easy, what's the last thing I want to do on it? The last thing I want to do on it is yank on it. I mean, it doesn't make any sense to do that. I wouldn't really put it around a bag of chips that's going to rip it, right? It doesn't make any sense. So if my Achilles is frail, why would I just want to wrench on it all day long? That's really not a good idea. So I would advise just not stretching it. I would advise doing these exercises to realign the collagen fibers. So basically the idea is that the collagen fibers are all knotted up together and they can't slide like they're used to. They're used to sliding like this and accommodating to stress. That's a healthy Achilles. But they get all wrinkled and crumpled up and all dehydrated. So we're going to get them to realign again by involving motion. Now, what you'll obviously want to do, so this is a foam roller. So you want to make sure you're just kind of like just skating through and just foam rolling through the calf, right? So the basic idea in foam rolling the calf is that you're just going to hold dead pressure on the muscle belly up here, the gastroc and the soleus, and you're just going to hold dead pressure, finding the trigger points, and once you find the trigger point, you just stop and just hunker down and just get that area to release. Now you might be on a sore spot for 2 to 3 minutes just to get it to release, all right? But that's kind of what you're doing, is you're just getting the soft tissue up in the meat of the muscle loose. Now, if you roll down to the Achilles with this, you'll find you're not really going to be able to get much of a release with this, because obviously the surface area of the Achilles is smaller. So we have to move to a smaller surface area. So my torture device of choice is the Sorite. This is for your hip, but I use it on the Achilles. Now, this is my treatment of choice for this. I'll get in on the Achilles. So basically, once the tendon starts, or the muscle starts to change to the tendon, I'm going to start on that north end and work my way all the way down, okay? Down to the heel. Not on the bone, but just a little bit north of the bone. So this kind of chunk here I'm working. Now I'm just going to kind of lunge in, find a little bit sore spot. Now if you absolutely, when you first lunge in, you absolutely have to keep your foot relaxed. So that way you're not flexing the tendon to kick it off. So you have to keep the foot nice and relaxed, sink deep into the Achilles. It feels fantastic. And then once you're there, you're going to just gently move the Achilles into dorsiflexion, or the foot into dorsiflexion, thus stretching the Achilles. Just like that. And you're going to just gently kind of cycle through and get these fibers to realign. So going back to that analogy I sort of used, or that image I sort of used with the fingers, right? You're getting the fibers to realign and glide rather than them being tight like this. I don't do this before I run, okay? I do this kind of late in the day, maybe before I go to bed, before like a long run the next day sort of thing, so I can trust that my Achilles can hold up for this session, the day before a marathon or something like that. So again, this spot to me is quite interesting. It's sending goosebumps all over up and down my leg. It's a lot of contention in there, so I'm getting it to release pretty good, okay? So I'm just hunkering down and just kind of gently mobilizing it. And I like to work this sort of in that 7-second fashion as well, like I'd say in some of my videos, where you mobilize it for 3 seconds, hold it for 1, and then just kind of mobilize it back and forth for three seconds. And then once I kind of feel like that spot's adequately released, then I'll drag it a little bit farther down and go to a new spot. Okay? Now, obviously look at the difference in surface area. So this will not be effective. You need something small like this. But if you're like, I don't have a so right, then potentially use a kettlebell. Not perfect, but can get the similar result. So I'm going to use the left one now. Here it's not perfect because it can fall easy, and then that's not great. But you can still get the same concept moving, right? You're just going to lunge in and just gently mobilize just like that. Okay, and the other leg, if it hurts too much to be here, just without the other leg support, then just be here just like this. But if you want to really get masochistic and you want to really feel like you're getting good work in, then add the other leg just to add a little bit more torque in. But be cautious, you don't want to injure it, so you have to move slow and controlled and basically stay off of the bones and deep into the meat of the tendon, right? So you don't want to be on the fibula on the side or the tibia on this side. You want to be directly in the tendon, right? And doing that at least a couple times a week and just that general motion, just really letting it dig in there, is really effective for tendinosis. Thank you.